But I think really one question that patients should always be asking, for me, it's not a matter of if a patient should consider a clinical trial. My view is a patient should always consider a clinical trial. I think the more relevant question is when to consider a clinical trial. And I believe at every sort of decision point throughout the patient's journey, don't like the word journey, but throughout the patient's journey, they should be thinking about clinical trial as an option. I think clinical trials should be really first consideration for patients as opposed to something that's done as sort of a last resort. And let me sort of describe that a little bit. I think too many patients think about clinical trials as, I've gone through all the possible treatments, nothing has worked, oh, I'm completely desperate, so now I'll think about and look for a clinical trial. And I guess my 10 years of experience would suggest that's not the right approach to take, and that what you really should be doing is thinking about a clinical trial at your first decision point. And again, particularly for an oncology patient or for a pancreatic cancer patient, if and when you get into a clinical trial, it's not like you're going to be on a placebo. It's not like they're just experimenting with you with a sugar pill. Because if that were the case, I would never join a clinical trial in oncology. Some other areas, not a big deal, it's okay. But in oncology, you've got cancer, right? And you want to deal with your cancer. So either give me the current best standard of care treatment option that's available, or give me the other arm that puts me onto a clinical trial. Right? And I think that's sort of the mindset that you need to take, because for pancreatic cancer, you need to be aggressive. Because maybe when I started, the 5-year survival rate was under 5%. Current information, it's up as high as 13%. But to be honest, that still sucks. Pancreatic cancer is probably the most deadly form of cancer, and unfortunately, it continues to increase. So whatever you can do to help your odds, you should do.